Cabinet meeting. Good afternoon. Thank you for joining us here today. Yesterday, the World Health Organization declared COVID-19 to be a pandemic. Last night, the President announced some extraordinary measures to minimize travel and to encourage social distancing. The NBA suspended games for the rest of its season. And within the last hour, after preparing for this press conference, the Maine Center for Disease Control and Prevention has informed me of the first positive presumptive test for the novel 2019 novel coronavirus, COVID-19, in Maine. The individual who tested positive, presumptive positive, is a woman in her 50s who lives in Androscoggin County. The Maine CDC is speaking with her and her medical provider to assess her travel history, and they've already begun investigating possible community exposure. That individual is quarantined in her home. I know I join the people of Maine in wishing her a speedy recovery. I know this news can be concerning, but the CDC, the Maine CDC, has been preparing for this eventuality since the end of last year. Dr. Nirav Shah, director of the Maine CDC, has assigned more than 30 of his staff to work on preparedness and response. I have convened a coronavirus response team composed of key department heads, headed by Dr. Shah, and they are coordinating our state's preparedness and response efforts. Our administration has been in constant contact with public health and medical professionals, hospitals, long-term care providers, school officials, EMS people, county, local, and tribal governments, and others to provide guidance and recommendations. We are also testing in the state's laboratory, and yesterday, the United States Department of Health and Human Services awarded Maine $4.6 million to support our ongoing work to protect the health of Maine people and the health of our communities. Today, we're taking some additional steps. First, I am proclaiming what is known as an insurance emergency. While the term emergency sounds severe, this proclamation essentially means that I'm using my executive authority to improve access to medical care for those who may have the virus, and to authorize the Maine Bureau of Insurance to require insurers to cover costs related to testing for coronavirus. The Maine Bureau of Insurance has determined the extent of the coverage required and has issued its own proclamation today. Several of our private insurers have already said they will not charge for testing, and I'm grateful for that. The next step will be to ensure that the plans also cover co-pays and other costs associated with testing, as well as improved access to prescription drugs and telehealth and any care that may be out of the plan's network. While this proclamation affects only private insurance sold in the commercial market, the Department of Health and Human Services is also issuing emergency rules to ensure that MaineCare provides comprehensive coverage for lab testing and medical treatment. Cost should not be an obstacle for anyone seeking a diagnosis or health care treatment for COVID-19. Second, Maine residents depend on us and state government to deliver vital services around the clock, every day. Through winter storms, natural disasters, and now the threat of disease outbreaks, protecting the health of state workers and the people they interact with is critical. And with 39 states confirming their own cases of coronavirus in addition to Maine, I am temporarily suspending all non-essential out-of-state work travel from Maine state employees. This suspension will last for 30 days, at which time that policy will be reevaluated. The determination of whether travel is or is not essential is in the discretion of the commissioners. It is my hope that this step, which has been taken by other states, will further protect the health and safety of state employees who work hard day in and day out as well as the health and safety of the Maine people they serve. Third, with one presumptive positive case, Maine has a unique window of opportunity to delay any outbreak like those we see in other states and to minimize exposure. Because the virus spreads easily and rapidly, the United States CDC has recommended social distancing. This means keeping your distance from other people, especially those most at risk of getting sick, including older adults, people with serious chronic medical conditions. Social distancing is one of the most effective strategies to prevent community spread of the coronavirus. In light of that guidance, and upon the recommendation of my coronavirus response team and the experts at the Maine CDC, I'm recommending the postponement of all non-essential large indoor gatherings, 250 or more people, for the next 30 days. This is a recommendation, not a mandate, but I'm taking this step not lightly, but with the hope that it'll prevent the need for the sort of mandates we're seeing in other states. Reducing the interaction of large groups of people across the state, I think, will delay an outbreak and may substantially reduce the spread. Delaying or mitigating an outbreak will reduce the strain on our healthcare system so that it can respond effectively to people diagnosed with the virus and still take care of their regular patients. This is why your efforts to limit your exposure to others, to stop the spread of this virus, are so important, no matter how healthy you are. I want to be clear, this is not a recommendation to close schools. This guidance refers to non-essential, large, indoor events, those with more than 250 attendees, such as basketball games, hockey games, and other large gatherings. Ultimately, organizers of the events will decide for themselves the necessity of holding the event using the guidance issued by Maine CDC today, and Maine people individually will decide for themselves whether they really need to attend. We will reevaluate this recommendation in 2 weeks and adjust it based on the circumstances at that time and on the latest guidance from the US CDC and the Maine CDC. Our approach is based on science and fact, not on fear, on caution and compassion, and the hope that we, as a community, as a state, as a team, can limit the impact of COVID-19 on the people of our state. Finally, I just want to emphasize the basics once again. Wash your hands often with soap and water, 20 seconds. And when soap and water are not available, use alcohol-based hand sanitizer. Avoid shaking hands. Now, this is a campaign year for many people in the state of Maine, and I, in public office, am used to shaking hands and giving hugs. I've tried very hard not to shake hands for the last 2 weeks, and I'm going to continue that practice. No offense to the people whom I love and the people whom I love to greet on Main Street in Farmington and in this building and elsewhere. We're not shaking hands. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick, and stay home if you are sick, please. Avoid visiting older people or people with chronic health conditions. Avoid visiting them in person in order to protect their health and safety. Find other ways to show that you love them. Call them on the phone. Write them, email. Use Skype or FaceTime. Social isolation is a concern at times like this, but Maine people are resourceful, and we will continue to support each other. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Wipe down things you touch often, doorknobs, car handles, phone screens, home and workplace equipment. Wipe them down with disinfecting wipes to protect you and others. Taking these simple, important steps will protect you, your family, your neighbors, your coworkers, and our state. And if you have a fever, a cough, or shortness of breath, which are symptoms of a possible virus, please stay home and call your doctor's office. Maine CDC is in regular touch with medical providers across the state. They're ready to advise you by telephone. And of course, if you've recently traveled to Italy, South Korea, China, or Iran, and if you have any symptoms, please stay home and avoid social contact for 14 days. If you have general questions about the virus, call 211 or email info@211maine.org to get information at any time of day. To the people of Maine, I know you are concerned, many are worried, and that concern and that worry is a reflection of how much we all love and care for the people in our lives, the people in this state. It's a reflection of the goodness of Maine people. We've planned and prepared for all eventualities and are now focusing on reducing the opportunity for this virus to spread. In the meantime, I ask the people of Maine to continue to do what Maine people have always done: calmly prepare, take care of yourselves, be patient, be cautious, be diligent. Seasoned professionals across our agencies, including health experts and providers, have risen to such challenges in the past, responding to diseases like H1N1 influenza, the West Nile virus, and the like. They will do so again. My administration, through our response team, will continue to work closely with the U.S. CDC, with health providers, and with communities across the state to respond to and mitigate the threat of this virus. I encourage people to seek information from credible sources, such as the Maine CDC and the U.S. CDC at cdc.gov. Preparing ourselves with facts and with science, with proven public health measures and common sense precautions in our personal lives are the best ways to protect ourselves, our friends, our families, our state. We're following the advice of the leading infectious disease expert, Dr. Anthony Fauci, who yesterday quoted Wayne Gretzky: "Skate not to where the puck is, but to where the puck is going to be." That makes sense to me. To the people of Maine, take care of yourselves. Stay safe. Stay healthy. We will get through this. Thank you. I'd like to now call on Dr. Shah for any statement he may care to make.
Thank you very much, Governor. Good afternoon, everyone. My name is Nirav Shah. I am the Director of the State of Maine Center for Disease Control and Prevention. I'd like to provide a few comments on two aspects of what the Governor noted. The first is what will now happen with the epidemiological investigation in connection with the first reported presumptive positive case of COVID-19. I would then like to provide a little bit of a scientific discussion that explains the underpinning and rationale for the discussion around large gatherings that the Governor mentioned. With respect to the first presumptive positive case in Maine, as the Governor noted, this is a woman in her 50s who's currently a resident of Androscoggin County. The test result that we received just about an hour and a half ago was conducted at the Maine State CDC laboratory just around the corner from here. The patient is not currently hospitalized. Our primary concern right now across the administration is to ensure the well-being of this individual, to make sure that we are able to work with her, to secure her all the care she needs, and wish her a speedy recovery. Our team of epidemiologists at the Maine CDC, these are our disease detectives, the gumshoes out there that now turn into high gear to put into place the protocols that we have been practicing and developing for several weeks now. They have already been in contact with this individual, as well as her healthcare providers, to start finding answers to some of the central questions that we ask in situations like this. For example, what travel history, if any, does this individual have? And if so, from where did this individual return? And if so, when did this individual return? We will also start working with this patient to start determining what degree of contacts, if any, she may have had with individuals upon her reentry to the United States, if indeed she traveled. The process of finding answers to those questions, as you can imagine, takes time. As other states have done in this situation, we will report that information as it becomes known. We also, of course, have to balance this individual's need for privacy. So we will again follow the lead of other states in this regard and report information from our epidemiological investigation as it becomes available. Again, I'd like to underscore that our primary focus right now is working with this individual to make sure that she has everything we need so that we can get her on the road to a safe and speedy recovery. I'd also like to discuss a bit of the scientific underpinning behind the large gathering policy recommendation that the governor noted. Right now in the state of Maine, with one reported presumptive positive case of COVID-19 just in the past 90 minutes, we still have an opportunity to maximize our window of opportunity to delay any type of onset or reduce the peak of any type of outbreak that may occur here. The governor's guidance around limiting large gatherings, especially those that are non-essential and indoor, to no more than 250 individuals, is rooted in what the governor noted as being social distancing. Right now in the United States, in many parts of the country, COVID-19 has reached what is called community transmission levels. Community transmission means infections within a population that are not imported from another affected area. When community transmission occurs, social distancing is the key to reducing the spread and lowering the peak of any outbreak that may occur. In epidemiological terms, we call that flattening the curve. Hypothetically speaking, there are two possible scenarios. One, with a very high number of cases in a very short, intense period of time. Think of that as a high peak. The other scenario is the same number of cases, but it's spread over a much longer period of time. Think of that as a flat curve. Our goal right now is to flatten that curve as much as possible so as to reduce the strain on the healthcare system. Because COVID-19 spreads among individuals who are known to be in close contact with one another, suspending large gatherings is an important tool to limit the spread of that disease, if any. In addition, measures such as these limitations on large gatherings are the most effective when they are implemented before a community experiences widespread community transmission. That is the situation that we are in right now. The goal of this operation, of this policy recommendation, is to maximize the window of opportunity we have to try to reduce the number of cases and flatten the curve as much as possible. With that, I will take any questions? Okay, great. Thank you very much, everyone.
We'd be happy to answer a few questions if you have them.
Do you plan to do anything here at the State House following the meeting happening on Capitol Hill in Washington? Any restrictions here?
Any restrictions in the State House proper would be up to the legislature. The building itself is within the jurisdiction of the presiding officers.
Are you concerned about it here? Because there seems to be a fair number of people that will probably be in that vulnerable demographic, the most vulnerable demographic. I mean, just the composition of the legislature itself is...
There are people of all ages in the legislature. We've given the guidance we've given. It is up to those individuals to take appropriate precautions as we've suggested, and up to the presiding officers to take any further measures.
I would also add that we have done several briefings for members of the legislature, including the presiding officers, and acting MEMA Director Pete Rogers and I did a full briefing for the entire legislature on what is known about coronavirus and how they can prepare themselves.
Are there going to be screenings at hospitals, other places that are large places that people go often?
I'm not sure that I would consider a hospital to be a gathering. If there were groups of 250 or more gathering at a hospital, it's a
But
different
screenings
issue.
for public places?
Right now, the testing capacity at the Maine State Laboratory here, we believe is adequate, as well as the fact that providers have been briefed on the testing protocol for coronavirus 19 since very early on. Very, very early, one of the things that Maine CDC did first was start working with providers to educate them about what is known about the virus. When testing went online, we subsequently worked with them to ensure they knew how to collect samples and send them to our laboratory. Based on what we know right now, that's sufficient to monitor or to have the capacity for testing.
Do you feel like, okay,
Should testing be increased? It looks like we've tested about 50 people. Should that ramp up?
As of this morning, we have tested 66 people, 65 negatives and 1 presumptive positive. There are no backlogs or anything of that sort. But testing right now, according to the United States CDC's guidelines, is the decision of the healthcare provider. Maine CDC does not stand between the healthcare provider and any patient. The guidelines recommend that providers use their clinical judgment to determine whether the signs and symptoms that a patient has are consistent with COVID-19 and whether any of the exposures that that patient has, for example, recent travel, would be suggestive of COVID-19. So right now, the process of testing is very much one that is left up to the provider's discretion. We at the Maine CDC laboratory are ready to receive those tests and run them and return results as quickly as possible.
Should those tests, should the state be more aggressive about pursuing more testing? I mean, that's been the criticism of the federal response, is that there isn't enough. If you're following the guidance of the federal government, should there be more here?
Right now, the guidance of the federal government is that individuals should be tested so long as their provider determines that they have signs and symptoms compatible with COVID-19, even if that individual has had no travel. So we're in a position where the guidance is quite permissive as to who should be tested. One of Maine CDC's goals for the past 3 weeks, since testing became available nationally, 4 weeks, is to encourage providers who see patients of that sort to think COVID-19. Even though we're in a setting of almost near peak flu season, COVID-19 is now there. We've seen community transmission, but given that physicians now determine who should be tested, our message from the Maine CDC has been to encourage providers to think COVID-19 when they see a patient. We have been encouraging providers. We've provided them materials on how to conduct the test, how to alert Maine CDC that they are conducting the test, that they would like to order the test, and how we will communicate those results to them.
You said that community spread is possible, although it doesn't seem like it's at that level yet here. Why would you say that, and what has the state been doing to track where the virus could emerge further, if that is the case? What is the state doing to prepare if that does occur?
Community transmission is a possibility in Maine. It is a possibility that we have been preparing for since late December of 2019. Recognizing what was happening in China at that time, we started evaluating the possibility of something of that sort happening here, preparing for it, and now responding to it. There are certain populations that we are particularly concerned about, most notably individuals in long-term care facilities. Early on, we started working with long-term care facilities through the Department of Health and Human Services, as well as their stakeholder group, to make sure that they had the latest guidance from the US CDC on how they should prepare. Earlier this week, Maine CDC issued guidance to the long-term care facilities and assisted living facilities in the state to instruct them to begin preparing for the possibility of community transmission. That guidance included common sense things, like starting the process of making sure everyone who comes to visit has verified that they don't have symptoms, that every employee verifies that they don't have symptoms, and then preparing for the possibility that visitation may need to be restricted even further.
When you talk about maximizing the window of opportunity, I mean, should nursing homes ban visitors? Businesses are wondering, should they send people to work from home? I mean, should there be more steps that are being taken?
I spoke to the Chamber of Commerce in the Hall of Flags early this morning and suggested to them that they consider encouraging employees to work from home if they can. If they can reasonably, feasibly accommodate that, it's advisable. It's entirely up to them. She had another question, I think.
Just the nursing homes. I'm just wondering, should...
Patty, it's a good question. Excuse me, Governor. It's a good question. In our guidance, we signaled the fact that nursing homes ought to begin preparing for the possibility of restricting all non-essential visitors. But we also recognize that visitors in long-term care facilities are an essential part of preventing social isolation of the very residents there. We also recognize that visitors can be effective advocates for the residents in those homes. So we have to balance those things. We've signaled to the long-term care community to begin thinking about that, because if we achieve or if we arrive in a situation where community transmission becomes widespread, that balance may need to tilt in one side over the other.
You ban travel for state employees, not essential travel, as you put it. What's your recommendation for everybody else? Spring break's coming up for public school families. Should folks not travel outside of Maine if they don't have to?
We're asking them to use their own judgment. If it's essential travel, that's their decision. I have some authority over state employees at this time, and we know what the contracts are allow for, and we've been dealing with Commissioner Figueroa about what we can and cannot or should not recommend for state employees. Local communities and town governments are similarly looking at their policies. We've asked the Chamber of Commerce and businesses to look at their policies as well and take appropriate precautions.
Governor, the legislature is awaiting a change package on a supplemental budget. Have you taken in the possible economic impacts of what the virus may do to the state's budget and economy, and has this impacted your decision making on this change package?
Yes.
And can you give us any examples of how?
No, in response, we're still working this out. I've met with the Republican members of the Appropriations Committee, or the leads, and with the chairs, the Democratic chairs of the Appropriations Committee. Talked about a variety of scenarios. We're still working out what might be immediate needs and what we should ask for healthcare-related budgetary expenses.
Can you talk more about paid sick leave for businesses, small businesses who take a big hit from this? Are you guys talking about that?
We're encouraging businesses to allow paid leave. If you have sick leave, to use it if you show any symptoms of the virus, or if you're under quarantine, to use whatever leave you have available. We're encouraging businesses, large and small, to be generous with their leave administration, leave policies, to accommodate this need for social distancing, the need to contain any spread.
When is your legislation to move your paid sick day law forward? It's implemented in January. Would you consider something to move forward now, also to expand it to more workers that maybe might not have the option to stay home, shift workers, restaurant workers, those kinds of workers?
The leave bill, as enacted, takes effect next January. It's undergoing rulemaking right now. It's up for public comment very shortly. Again, that's on top of what leave policies are in place right now for businesses large and small. Most of the businesses in Maine already have leave policies. We're asking them to be very generous in the application of those existing leave policies.
How prepared is the Department of Education?
I'm sorry?
How prepared is the Department of Education to deal with this?
The department is prepared. We've been dealing with, Commissioner Macon has been talking to the superintendents and school officials across the state about what they may or may not want to do.
Right, and our department has been in daily communication with Dr. Shaw and the CDC, Commissioner Lambrou, and the governor's office every single day, multiple times, for real-time updates on the situation. We have been passing that information along to schools in real time through a website and through direct contact emails on a regular basis. All of the Maine schools have emergency management plans, which include either a pandemic or infectious disease component. We have been providing technical assistance to the field and professional development and support in updating all of those types of plans. And we are feeling that our schools are as ready, and our department is as ready to support them as anybody could ever possibly be in a situation like this.
Thank you.
Dr. Shaw, when would we expect to get more information about the positive case or travel history, whether there are other family members that might have been exposed?
The answer is as soon as it's available. As you are aware, I've been conducting daily briefings for the media, in addition to briefings for members of the community and other groups. As soon as that information has been procured by our gumshoe epidemiologists and verified with the individual, we will share it with everybody.
Community we're talking about?
I'll get back to that question in a moment. What I think is really important right now is for everyone in Maine to do a few things. The first is make sure you're taking care of yourself. At this time of the year, we urge everyone to do the things that you would otherwise do to stay healthy. Eat a good diet, get a lot of sleep, get your flu shot if you haven't done so. We also urge everyone to stay informed. This is a situation where fear and misinformation can spread far more quickly than the coronavirus itself. Governor Mills noted that some of the best places to get information are the US CDC's website and the Maine CDC's website. And the third thing I would ask everyone to do is to prepare but not panic. The information that we have is known. We are working on developing further information and will share it with members of the public as soon as it is known. But if Maine people have individuals in their household who are older, who have chronic medical conditions, as I'm doing with my own mother, now is the time to start preparing but not panicking. There are information and resources on what to do available on our website as well as that of the US CDC, but it's a time for all of us to stay informed, to be kind, and to take care of one another.
Good message.
In that spirit, can you share?
211 line yesterday to kind of give people information about the coronavirus. Can you talk about how many people have called that and what are kind of the contents of those calls?
Great.
I'm sorry, could you repeat the question?
He opened up the 211 line
Oh, right.
for information about the coronavirus.
We will get you the latest call statistics quite soon. What I can tell you is that at our morning meeting, the nature of the calls that have been received by 211 are questions of a general nature, such as, are there confirmed cases in Maine? Should I travel to country X? Or rather, what does the health department say about travel to country X? What types of things can I do to start preparing? Where can I get further information? That is exactly the type of questions that we would like everyone out there to call 211 and ask about. That's the right way to use 211, and we encourage everyone to do so.
Or go online?
Or go online as well.
Will you share what community you're talking about, or city in Henry County, or if that comes out later, anything different in terms of preparing but not panicking that people in that community ought to do?
Our practice in this situation will be to follow what other states have done, which is to release the county. We do that in order to balance the public's need to know with this patient's need for privacy. What other states have done thus far with respect to COVID-19 is to release the county of residence, and that's our intention here.
You mentioned an insurance emergency. What, if anything, is the state doing to kind of help people out who may be underinsured or uninsured, who may be afraid to go get tested?
Right. Eric?
Well,
The test really doesn't cost.
Right, the
Right.
CDC
Yeah.
isn't billing for that. Yeah.
Right.
for underinsured, we're requiring that the screening and testing be no copays, no deductibles, no charge to the consumer. And that's what we're doing there. And for prescription drugs, we're requiring complete access to prescription drugs that are necessary as well.
Can you give more details on what types of prescription drugs?
Well, for instance, carriers have something called a formulary. If they run out if they run out of a drug that's needed, they have to make an alternative available to the consumer at the same cost.
I might just add on the formulary, the prescription drug issue, one of the pieces of guidance that we've gotten from CDC is that people should try to fill their prescriptions on a 90-day, not a 30-day basis, to prevent them from having to go out when they don't need to make sure that they're prepared. Both the guidance I think that we're doing at the Maine Care would allow for that, and we are encouraging our private carriers to do that. And going back to your question about the uninsured, Maine does have a strong safety net of providers, our clinics, our hospitals, that we are working with on a daily basis as well to make sure that they have the support and the resources they need to make sure that, as the governor said, no one in Maine forgoes getting tested or getting treatment for COVID-19 because of cost.
And the other thing I would add, my order is all about making access easier for Maine consumers, making access to providers, making sure they can see their providers without jumping through hoops during this period.
When you say no copays and no deductibles, that's just for the doctor's visit or urgent care visit or ER visit associated with the test, is that correct?
That's test and screening.
What about the treatment if you've got it?
Well, right now, we're not treating it as different as any disease. I mean, the insurance policy will cover the disease, but the policy will apply. Again, this is a fluid situation. We're going to monitor it, and I have broad authority, and, if I have to take additional action, I will.
One more question, perhaps?
Social distancing of this sort as well, and coupled with this policy recommendation to limit the size of large indoor non-essential gatherings, will be one of the keys to reducing the spread of coronavirus. What I'd like to say around that is a few things. The first is it's important to note that one of the reasons we are taking coronavirus seriously as a nationwide global public health community is that there is not immunity to it, in a way that there may be partial immunity to other diseases like the flu. There is also, at this time, not a vaccine for it. As a result, the strongest tool that we have in our kit is to prevent individuals from coming into close contact with one another. Because the virus, the principal way that it spreads and generates outbreaks is through respiratory droplets that are transmitted in close proximity, within 6 feet. The scientific principle, the root of the social distancing and thus the large gatherings, is to distance folks so that that spread of respiratory droplets does not occur. What that does is interrupt the normal scientific natural flow of the virus. If you think about things from a virus's perspective, the goal of a virus is to get into as many people as quickly as possible. By limiting large gatherings, by social distancing, you interrupt that virus's natural flow and inhibit its ability to go from person to person to person, thus causing an outbreak. It's important to note as well that the goal of social distancing, the goal of limiting large gatherings, is not necessarily to prevent cases. We hope that happens. But the goal is to flatten that curve, to reduce the number of cases and spread them over a greater period of time so that the resulting strain on the healthcare system can be managed far more systematically. I think about it as if I were waiting for a bus. If there's 150, 200, hundreds of people waiting on the bus terminal for one bus, there's going to be crowding. That's similar to the hospital. But if we can stagger the number of people who arrive at the bus depot so the buses can take them away in a more ordered fashion and care for them, that's a much more manageable situation. That's what we're trying to achieve by social distancing.
Great.
Folks, Dr. Shaw can stay behind to answer any lingering questions.
Thank you, everyone.
Anything else? Thank you.
Yeah, he actually can't. Do you want to correct
I'm sorry, Dr. Shaw has to run and do something at 1 o'clock, so he cannot stick around.
But I'll be honest, if we have any colleagues, so just call there.